Okay, so let's do a quick talk on irregular and infrequent periods. So, as usual in your history, you want to take, you know, what's the normal cycle LMP, baseline and normal cycle, associated history symptoms like fatigue, update in sexual health, smears, and any sexual symptoms of dyspareunia, any iatrogenic stuff like contraception or HRT, um, and also any associated features of hyperandrogenism like weight gain or hirsutism. What's their future family plans, and are they, any menopausal symptoms which they're unlikely to have at this age. You want to do an examination just to see height, weight, blood pressure, any peripheral features of hyperandrogenism, an abdominal examination, consider a pelvic examination as well, and update their gynae history. So there's a number of causes of this. So basically, you're going to call it primary, secondary, or oligomenorrhea, and it's usually caused by a thyroid problem, which you can check for thyroid function, premature ovarian insufficiency, which you need to do some blood tests, which would include FSH and LH, TSH. You can do for prolactinemia, you can do prolactin, and there can also be a rare cause of hypothalamic pituitary dysfunction. But the key is testosterone, so your total testosterone, and you want your sex hormone binding globulin. So note that in contraception, the biochemical markers of hyperandrogenism would not actually be difficult to interpret. You can do imaging as well. You need more than 12 cysts. You need clinical features, bloods, and 12 cysts. And just remember that in children, you're going to have a totally different approach, because if you start them on contraception to actually treat the individual parts of PCOS as you would do, then you want to investigate them sooner to prove it. The complications of PCOS, you would also check for things like cardiovascular health, metabolic disorders, obstructive sleep apnea to obesity, mental health, and infertility and pregnancy complications. There might be, a slightly higher risk of cancer, and also we mentioned non-alcoholic fatty liver disease. So it's mainly lifestyle stuff. So in order to assess this, we need to promote a healthy lifestyle. As you said, manage the individual options like acne and hirsutism. Acne and hirsutism, and whether this is hirsutism, and you can use oral contraceptives for those. You can consider things like Yasmin or Dianet, and you consider something like L-nafornethine cream. You can also refer to endocrine and use spironolactone as well if you need it.